This is a new virus, and that is why this virus is concerning. Some people ask, why would we care much about this virus since most of the people are going to acquire it, are going to be fine, they're going to go through probably a mild illness and they will be okay. And that's reasonable. However, since we know this is a new virus and it's a virus that was transmitted from animals to human beings, we don't know how it will behave. It might mutate into a stronger form, or it might mutate into a weaker form. The other problem is we don't have any kind of treatment or vaccination for this virus. Now let's back up and talk about viruses in general. Viruses need a cell to be able to survive. Most viruses that you see that cause either an upper respiratory tract infection or a gastrointestinal problem are mild. They cause disease. You feel bad for 2 to 3 days, but then the body's defenses overwhelm that virus and the virus goes away. And viruses don't need treatment, and good physicians don't give antibiotics to viruses despite the population, sometimes the patients demanding antibiotics. Viral illnesses will go away by themselves most of the time. But when we talk about virus that has a relatively significant mortality rate, and that is close to 1%, when a virus kills 1 out of 100 people, then that is a very serious virus. But see, with influenza, we have a vaccine. And with influenza, we have multiple medications now that treat it. Whereas for this particular virus, we have yet to come up with a vaccine or with a treatment. So if we go into the future, 10 years from now, this particular virus will not be a problem. It would be something that has happened. Probably this epidemic, possibly next winter, we might have a small epidemic. And historically, the second winter is less aggressive than the first winter. But by then, we would have vaccination, we would have treatment, and it wouldn't be such a big deal as it is today. But if you have an autoimmune problem, if you are a cancer patient, if you are an AIDS patient, definitely you do not want to acquire this virus, because this is where mortality happens. And these kinds of patients have to take extra precautions to avoid populated areas or people who are sick, simply because if they acquire it, all we can do as physicians is to give them hydration, to give them pain medication, but in reality, we're not doing much. And we can't do much until we have an appropriate medication to treat that. I will give you an example, a historical example that most people, if not all people, recognize, and that's HIV. If you go back into the mid-1970s, there was no such thing as HIV. The human immunodeficiency virus, which is HIV, which has caused a disease that known as AIDS, acquired immunodeficiency syndrome. And if you recall, historically, we have had thousands and thousands of people get sick and thousands died before we came up with proper medications for the disease. Currently, as an infectious disease practitioner, I have a high number of HIV patients, and I can tell you 99.9% of them are doing well. They live a normal life. All they need is 1 pill a day, just like you would do if you had high blood pressure or diabetes or any other kind of chronic disease. Why is that? Because again, we found a medication that is able to control HIV, and we are working on vaccinations to where hopefully in time people won't have HIV once we give them the vaccine. However, again, in the early 1970s, there was no such thing as HIV. So these viruses are transmitted from animals to humans, sometimes through eating animal meat and in other ways that have yet to be determined. Simian immunodeficiency virus is known to be an HIV-like disease in monkeys, and we think that possibly this is where HIV came from. Now, you move on to other epidemics like SARS or MERS or currently the COVID-19. MERS, for example, is present in camels, as I said. And if you think about the highest population of camels, it's present in the Middle East. And sure enough, this disease is called Middle East Respiratory Syndrome, which is MERS, M-E-R-S. Now, we know that there are food practices in China that, whether or not we agree with them, I'm sure we have things in the United States that we do that might sound unusual or weird to other people. We know that this virus was present in animals and then it was transmitted to human beings. And this is the problem. When you have a new virus in human beings, all you can do for the first few months, up to sometimes years, is study the virus and see how it behaves. What it infects, what cells does it go inside, where it multiplies, how it multiplies. And ultimately, when you discover the life cycle of the virus, then you go and attack it at a certain point to stop that division, that multiplication, and that transmission. So that's on the biologic level. Do we know a lot about this virus? We don't. The Chinese know more than we do, and I hope that we can share their expertise and their knowledge about this virus so that we all can contribute to the treatment and ultimately to the vaccination against this virus. This will not be the last new virus we hear of. In a few years, I can wager that we will have another virus that will cause something similar to this. These viruses are present in animals, but we cannot detect every virus that's present in every animal. And these viruses can cause disease or can cause no illness in the animal. However, when it is transmitted into a new host, like human beings, that's when it has the potential to cause disease. There has been viruses transmitted from animals to human beings and did not cause any kind of illness. So again, the first stage is observation and looking at the life cycle and then determining whether or not we are able to interfere in that life cycle of the virus to prevent its transmission and ultimately to have vaccination against the virus. Some reports are saying that the SARS, when it happened, the SARS epidemic, there has been efforts to create a medication for SARS. And it looks like that particular medication, or that it's not a medication yet, it is still a chemical compound, might have activity against COVID-19. So if we're going to give something positive out of this, hopefully, if we elaborate on that, this particular chemical, this medication, hopefully will be effective, at least partially, against COVID-19. SARS, MERS, and COVID-19 are called coronavirus. A coronavirus is the class of viruses, and every virus has its own DNA, RNA, and its proper pathophysiology, nomenclature, and so on. But yes, the three viruses are part of the coronaviruses, and it makes sense that a medication or even a vaccine for one could be effective against the other. So even though we don't have excellent medications out there for SARS, MERS, definitely not for COVID-19, but the efforts in trying to create a medication for SARS might help us in finding a medication for COVID-19.